Newport counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare home care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
The following programming is furnished by you and your doctor.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, happy Monday and happy New Year. We're here on WWNN and I'm filling in for Lou Biazzi. Today I have a very special guest to us. He's Ed Salazar. He's a very decorated individual and he's very important to our company and we're happy to have him. And so I am, like I say, I'm filling in for Lou Biazzi, and I'm the vice president of All County Healthcare. And Ed, actually, he is with us as well. And a little background on him, he has been a respiratory therapist for over 40 years. He was born in Michigan. He moved to South Florida in 1972. He attended college at Broward, and he studied respiratory therapy technology. And he graduated in 1974, and since then he has served as a staff therapist, a shift supervisor, an assistant director, and a technical director for various pulmonary services in South Florida. And he is an author. He is the vice president of American Telemedicine. He sits on the board at Nova Southern University. And what else? Ed, he is the president of the Advanced Diagnostic Sleep Center, and most importantly to me, he is our respiratory therapy consultant. So thank you, Ed.
It's my pleasure to be here, as always, Clayton.
Good New Year's?
Very good, very good. Had some family from out of town, and we had a very good time.
Very good. So last week, we talked about staying on Medicare. Lou went over the differences with HMOs and straight traditional Medicare and how that benefits and affects the patient. So just for the listeners out there, perhaps they're familiar with us and maybe the new folks are not. We're a home care agency. And so we get a prescription from a doctor and we send nurses and the various therapists out to satisfy that order. So Ed, tell them quickly about how it would work if we got an order from a doctor and what you would go out to do to help with.
Well, my responsibilities with All County Healthcare are to develop a pulmonary hygiene team. So because currently Medicare and the other insurance providers do not pay for respiratory therapy services per se. So my job is to train the nursing staff, a team of nurses from All County Healthcare, to safely and effectively provide the IPV therapy, intrapulmonary percussive ventilation, in the patient's home. Typically we talk about using this for COPD, chronic obstructive pulmonary disease. But it's a very, very effective therapy for all manner of chronic lung diseases.
Very good. We're going to jump into that. I want to learn about IPV, and I wanted to tell you that in a past life, at my past agencies, I tried to employ this strategy where we would, hire a respiratory therapist, like you alluded to. It's not covered. It's one of the therapy services that's not covered within the Medicare guidelines for a home health agency. So we don't get reimbursed for that. But what we have at all counties is very different. So, like you alluded to, the IPV. So, tell us what's the magic there.
Well, IPV, it's nothing new. The technology has been around for over 30 years. It's high frequency ventilation, and typically it's been employed in critical care units. It's pretty much a gold standard in burn centers, trauma centers, where you have some very, very, very sick lungs. Now, the people that developed the technology, it dawned on them that if it's that effective on the worst conditions, why wouldn't it be just as effective on things of lower acuity? And so they employed this technology to treat. Right now, all county healthcare has a patient with idiopathic pulmonary fibrosis, which is a very, very serious condition. Had nothing to do with him ever being a smoker or anything like that.
Idiopathic means they have no idea why it's going on.
Yeah, exactly. But pulmonary fibrosis is a pretty grim diagnosis. But what we were able to do for this patient is dramatically improve his quality of life. We were able to improve his exercise tolerance, and we were able to get him to the point where he could actually enjoy, being with his family. And that's a very rewarding thing. At All County Healthcare, we've treated patients with Duchenne's muscular dystrophy. Here, the problem isn't their lungs per se, but they lose the ability to breathe deeply, to cough effectively, and over a period of time, these can lead to lung conditions. And our technology, this IPV therapy, greatly improves lung conditioning. It makes it easier for them to take deep breaths. It makes it easier for them to mobilize their secretions, and then prevent all the problems such as pneumonia that can develop from that.
Yeah, since I've been with the team, it's been pretty remarkable. Like I say, other agencies flirt around with this, and it's something that is not covered, and maybe we can dive into that. But I saw it in the ICUs, and I just had never heard about it being used in a home health setting before I got to All County. But tell me, so if an agency were to get a patient and they didn't have what All County had, what would be the alternative? What would you do for these patients in the absence of the IPV therapy?
Well, the classical chest physiotherapy involves having a physical therapist, a nurse, a respiratory therapist, somebody that will manually percuss the patient's chest, like a clapping motion, cupping motion. And the idea here is that these percussions will vibrate the lungs, help loosen the secretions, make it easier for them to cough it up. But this often involves postural drainage. You have to physically position the patient, flip them from side to side. It's a pretty big deal, and it isn't done in home care either. Not because it's not needed, but it's just I guess they feel it's logistically
too tough.
Too tough, yeah.
Yeah, so that's the interesting thing, is that we have to go out and we kind of have to educate the community on this service, being that it's something that we implemented in our strategy as a unique value add that we can provide to the patients that oftentimes is not included. You're not usually going to get a home care agency that's going to provide this for you. And so I just wanted to say, we don't really see this as like a competitive thing from what I've learned. Like, we would love for all agencies to do this, because it drives outcomes, and the data is publicly available.
Oh, sure. You can go to the INH and their website and look it up.
Yeah, and we're very happy with our scores. I mean, we've done a very good job to make sure that we provided everything that we can for the patients to have that outcome, and that's kind of what I talk to our team about. If I go out in the field and I see somebody, is that it's really not a money thing for us. It's a total outcomes thing, and we will spend that money if we know that the patient has that better outcome. So
It's definitely not a big moneymaker.
it's not a money maker.
Because you have to visit the patient probably twice as many times as you would with other diseases or other diagnoses that would require home care.
And common diagnoses are what? Let's talk about that, because I think a lot of people just think pulmonary medicine, maybe COPD.
Well, wound care, diabetic care, other nursing services other than pulmonary. But the number of visits required to care for somebody with a chronic lung condition usually involves it's a lot more involved.
Yeah. What are some of those other chronic lung conditions?
Well, we talked about pulmonary fibrosis. We talked about neuromuscular diseases, Duchenne's muscular dystrophy, things like that. But, you have people that, they're subject to pneumonia. They can get pneumonias chronically. People that have problems with occupational hazards. There are a number of different diseases or diagnoses that, that our therapy could work for. One thing, though, that's interesting, in the last 30 days, we've had 2 requests out of network. We've had 2 different patients come to us. One of them was a pulmonary fibrosis patient, but then they were not covered by Medicare. But the case managers from the insurance provider they were with sought out All County Healthcare to see if we could work with them out of network.
So they found us.
So the word is getting around. Yes, it is.
Getting around. That's great. And it's a great feeling. Well, I think we can jump to a break. I think it's time for a break, and we'll be right back.
Has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, everybody, and welcome back. Clayton Williams. I'm filling in for Lou Biazzi, All County Healthcare. We have our respiratory therapist. He leads the respiratory hygiene team. And we were talking about what we do. Quick recap is we get an order from a doctor and could have nursing and therapy on the order. To speak specifically about what Ed would help with, he would go out and see someone who has a pulmonary diagnosis, and we provide that feedback back to the doctor, and we're graded on these scores. And we've been sought out for this treatment. We're one of the few in town in our area that has this particular treatment. So I wanted to talk about probably the thing that circulates on the news more than anything today, and that is the coronavirus, COVID-19. And so before the break, we were talking about the various things that can be done with the IPV treatment. That's our secret sauce with our respiratory hygiene program. So Ed, tell us about if the agency were to get a referral for a patient who does have COVID, what would be your plan? What would you do for that patient?
Well, we use the appropriate PPE, and, we take all the precautions to be sure that the caregiver, isn't infected. And, that can be done. There are a number of hospitals in South Florida that use IPV, and, they use it very effectively. There are many case reports about the use of high-frequency percussive ventilation to prevent the patient from getting such a severe pneumonia that they can't recover from it. When we get an order for a patient and, they say the patient's COVID positive and they want to use it either prophylactically, they want to try to prevent the patient from getting worse, or they're recovering from an exacerbation. The therapy can be employed. One of the biggest concerns that they have in hospitals, and one of the things that's causing, in my opinion, issues with these patients when they have to go on a ventilator, is that a lot of administrations don't want you to use aerosol generators. In other words, they don't want you breathing in with a ventilator, with a device that produces a medicated aerosol. If there's any chance that aerosol can be exhaled, and then that particulate matter might be contaminated with the COVID, and then, potentially infect somebody else. The solution to that is to very simply put a small, tiny HEPA filter, a filter that will, filter viruses so that nothing escapes, from the device. And that's what we do at home, too. We'll take a small disposable COVID, a HEPA filter, put it on the exhalation port. And this isn't for the patient's protection. This is for the family's protection or the caregiver's protection. So, there's no reason, why these patients cannot get these life-saving aerosols in spite of having a positive COVID diagnosis.
Got you. And there was a study floating around all county. I believe you unearthed it with your research, and I know that some of the marketers are using it in their presentations. Tell us about that.
Well, this was done in Italy, actually. And they took 3 different patients who had developed COVID and were, the congestion was getting to the point where they had to make a decision if they want to put them on a ventilator or not. But they preemptively used the IPV therapy, and the patients never had to go on a ventilator. And, there's plenty of information. I believe, the National Institute of Health has looked into this. I know John Hopkins has looked into this. And the research center in Palo Alto is doing a study right now on this. And there's a lot of data showing that if you can prevent the patient from ever having to go on the ventilator in the first place, then their survival rate is much, much better.
For sure, yeah. That's the thing that I've always heard, is that it's the sweet spot. You have to get a professional. You get someone on that ventilator, and you got to wean them off, and it's
a difficult thing. It's a very difficult thing to do.
So, we got IPV, we got COVID patients. The IPV is beneficial. It's getting studied. It's one of those things within medicine. You may be onto something. We don't want to put any patients in danger. And
the thing that I want to emphasize, it all sounds real technical and clinical and complicated. It's really not. When we talk about high-frequency ventilation, all it is a little device that develops these rapid pulses of air. And these pulsations continually going down through the airways. They do it with very, very low pressure. There's a lot of flow, but it's very, very low pressure. The analogy I always try to use is, you got the Mississippi River, and if you've ever been in New Orleans and you stood on that seawall there, that's a lot of water. That's a lot of force. But if you went down into the Delta and you go to all these little streams and all these little creeks, that's kind of like your lungs. You got the main airway coming in that keeps breaking down. By the time you get to the terminal airway units, which would be like those little creeks at the end of the delta, that water is just barely flowing through. So the more flow you can develop there, the better you're going to be able to prevent congestion from developing. And this is pretty much the same thing we're doing with the IPV. Those rapid pulses of air are going to keep going down into the airways, and if there's anything obstructing, eventually those pulsations will breach the obstruction. Once that obstruction's been breached, the air's got to come out, right? So you've got air going in, you've got air coming out simultaneously with very, very low pressure, but the air coming out is going to come out around the walls of the airway, and it's in a spiraling motion, and that spiraling motion is what mobilizes the secretions. So whether the patient coughs or not, we're going to clear those airways.
And the goal is just to get the mucus up. We got a question.
The IPV therapy, Ed, how is that different than the nebulizer? The nebulizer aerates the lung. It's more of an inhalation and an exhalation, but I know that some patients for congestion do nebulizer treatments. Is the IPV different than that?
It's the nebulizer plus. We use a nebulizer as part of the IPV therapy. But instead of just delivering it through spontaneous respiration, it's being augmented. the inspiration is being augmented by these pulsations.
And if the doctor orders any medicine, you can
whatever the patient is using into their standard nebulizer, we can use in the IPV.
That is great.
Yeah, it works. It's extremely frustrating to me. that we can't get a billing code from CMS. Before I was on board with All County, I actually went to Baltimore to CMS with the president of the company that manufactures the IPV, Percussion Air, and their chief medical officer. The three of us went up there, and we're talking to these doctors that are advisors to CMS, and they couldn't give us a reason why there was no billing code for it. Yeah. And I'm beyond frustrated.
No comment. Yeah,
I'm just beyond frustrated with the whole thing.
We are the boots on the ground, and we have just a couple minutes left, and we just wanted to thank you for coming on today.
It's my pleasure.
You are a very busy man, and you're very much so appreciated. I get questions about our program all the time, and the guy that came to give the presentation, and is he available? I just want to tell anybody that's listening, if you have a question or a concern for a family member, you want to get in contact with our agency, or you're interested in services that Ed can provide, perhaps through your Medicare, or if you'd like to pay cash, you can give us a call at 1-888-717-7170, and you can ask for Ed. And you have anything you want to say before we wrap it up?
Well, I'm very proud to be part of All County Healthcare. I went to different home health agencies, and every home health agency I went to, and I presented, my program, everyone thought it was a great idea until we talked about acquisition cost. All County was the only agency that was willing to give it a try, and Lou started with one machine, and it didn't take us long to keep that machine busy. So then I think they currently own at least 5 or 6 machines.
Very good.
Yeah.
Like I say, it is magic, and it is what we do for the patients. We're very happy when we get those referrals, and the outcomes speak for themselves. And like we say, that is all public information. Look us up, All County Healthcare. Lou is not here today. I'm covering for him. Ed is an author. He is our respiratory therapist consultant. Look up his book on Amazon. It's titled A Free Kill, and we're very happy to have him. Thank you so much, Ed.
My pleasure.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinion